Okay. So I'm going to walk in the room and do hand hygiene and pull the privacy curtain. Hello, Mr. Smith. My name's Ayana. I'm going to be your student nurse today. I have an order here from the doctor that your blood sugar was 254 this morning and you need 8 units of regular insulin. Can you tell me your name and date of birth? Matt Smith, March 22nd, 2000. And do you have any allergies, Mr. Smith? No. Okay, so we're going to do hand hygiene one more time. And I'm going to verify my order again. So 8 units of regular insulin for Matt Smith at 9 a.m. SubQ. So I have all of my equipment here that I need. I'm going to go ahead and get my regular insulin and wipe it with an alcohol swab on top. And then I'm going to retract 8 units of air into my needle and then uncap it. And then turn my vial upside down and aspirate that 8 units of air. Once I've done that, I'm going to draw back my 8 units of regular insulin. And while I'm doing that, I'm going to see if I have any air bubbles, which I don't. So I'm going to get the one-handed scoop method to recap that needle. And now I'm going to go back into the room and do hand hygiene. And I'm going to verify one more time I have the right patient. So Mr. Smith, will you tell me your name and date of birth? Matt Smith, March 22nd, 2000. Okay, so I have the right patient. I have my right dose, 8 units of insulin. I have the right documentation on my EMR. I have the right drug, regular insulin, and then the right time, 9 a.m. So I'm going to go ahead and do my hand hygiene one more time and put on my gloves. All right. So now I'm going to grab my alcohol swab and we're going to do SubQ on his tummy because that's where Mr. Smith says he usually does it. So we're going to start in the center and go outward. I'm going to leave my alcohol swab there so I remember where it's clean. I'm going to get my needle with my regular 8 units. Okay, Mr. Smith, I'm going to go ahead and inject you now. I'm going to pinch the skin and go at 90 degrees. And once I do that, I'm going to apply pressure if it needs to. And then I'm going to retract the safety needle and throw that away into the sharps container. And go ahead and take off my gloves and throw those away as well. Do hand hygiene. And then I'm going to check with my patient. Mr. Smith, are you feeling any pain? You look like you're in a good position, right? Okay, do you need to go to the bathroom or anything? Okay, and I see you have your phone. Do you need anything else? Okay, and no pipes or anything are in your way, right? Okay, so I'm going to go ahead and lower your bed and clean up all my mess. And I would leave the room. Okay, so for your IM deltoid injections, you are going to palpate the upper end of the arm and feel for the lower edge of the acromion process. And then you will inject 2 to 3 fingers below that, the acromion process. Okay, for your ventrogluteal IM injection, you are going to place your palm of your hand at the greater trochanter. You're going to use your right hand for the left hip on the patient and your left hand for the right hip on your patient. So basically just opposite. And then you're going to place your index finger on the antero-superior iliac spine and spread your middle finger dorsally to palpate for the iliac crest, and that should form a triangle, and in the middle of that triangle is your area to inject.